Thank you, doctors. What would any of you recommend for smaller children, say under 12, that who can't have the vaccine and don't have a vaccine available? What would you recommend for parents of those children and how to address and protect their children from COVID-19?
Vaccinate the adults they're in contact with, and the people over 12 who they're in contact with, so it's less chance they get infected. And Pfizer is doing the study right now with children down to 2 years old. And I think that data will come out somewhere before the late fall.
Also, do the other 3 steps that we have, which includes wearing the mask, washing your hands, the hygiene, surfaces, your house, where you go. And I certainly wouldn't be taking the kids anywhere where there's large crowds and bunch of people that are drinking and singing and having fun, because you're going to expose them. The Delta is very, very easy to catch. I would not be putting any of my children in that situation.
Just to tag onto that, one of the things we're seeing a lot more of now is younger populations coming in being infected with COVID. So earlier on in COVID, it was more of the elderly population. We're seeing a lot more of the younger population. We're seeing kids, we're seeing teens, we're seeing young adults, a lot more than anything else right now.
Well, and so related to that, seeing that it looks like from some of the data that Dr. Alonso had and some of the other information that's out there, that the Delta variant is accounting for over 80% of the new cases. What percentage of, and this is a guess, I'm sure, or certainly a scientific guess, what percentage of the variant cases do you expect in the coming months as we have more kids and young adults going back to school?
Well, it's clearly the dominant variant that's causing COVID now. So I don't expect that to die out until a different variant comes in or everybody's vaccinated to help protect against it. I mean, we're seeing such large numbers of it. We know that that's what's got 82% of the people getting sick now. We're seeing such large increases in the amount per day that it's just going to continue to go until we get enough people vaccinated to prevent it from happening.
Yeah, we do need to be careful with the kids. Just because they don't develop severe COVID disease doesn't mean that they can't go on to develop multisystem inflammatory syndrome. There are about 4,100 cases that have happened since the beginning of the pandemic. Those kids are very sick. They do wind up in the hospital. There have been about 300 and something deaths, I believe, in kids due to what's called MIS-C. There's a great site on CDC if you want to take a look at it. And protecting our young population who can't get vaccinated is still important. Chances are with COVID, they will not show many symptoms. They can catch COVID. They can easily spread it. There are several instances of an adult getting COVID from a small child who cannot get vaccinated. So that's also a concern. And just to put things into perspective, when we did close out the school year back in June, Alpha variant was the dominant one. And looking at the numbers as far as how much more infectious Delta is, this particular variant is about 4 times more contagious than Alpha. So we do have to do everything that we can to protect our young population, not just to keep them well, but to keep them from spreading it to all the adults that they come in contact with.